The first test that we'll do is get their weight, and we'll have a lot of discrepancies between their weight that they do first thing in the morning as opposed to when we maybe are weighing people after they've eaten lunch or after they've had breakfast or things like that. And also they're wearing clothes most of the time. So they're gonna be weighing slightly heavier, so just let the client know that they will weigh maybe 3 to 5 pounds heavier, and that's okay. We're just getting a trend and a baseline based off of our scale. So before you do their weight, you, dependent on the purpose of the testing, if you're doing biometric screenings that require metrics to determine insurance premiums, you'll want to make this reading as accurate as possible, making sure that they're taking their shoes off. We are not getting an impedance being sent through their electrical current through their feet, and so we don't have to have their shoes off, but obviously any extra weight that isn't true weight on their body is gonna reflect against those numbers. And so it is wise to ask the individual to take their shoes off and make them feel a little bit better about themselves. Also, if you are getting any error reading on the scale, our scales go up to 400 pounds, and so typically the reason that you might be getting that is due to them stepping on it too quickly before it's set up, or that they aren't applying even pressure throughout their feet, or that they could potentially be over the 400-pound range. Most of the time we can get the reading to register. Just make sure to have them step off, let the scale zero out, and then step back onto the scale, having them look straight at the wall rather than down at their feet, because a lot of times that can offset the weight, and so it makes it have an error occur. But have them look forward, and then once a reading occurs, then we can let them know to look down at the scale to get their weight. And so I like to be very interactive with the clients and making sure that I get up with them. I'm not just instructing them to do different things. And so I like to set the scale to 0 for them, just with a slight tap, wait till it zeroes out, and then have the client step on. And once it's been completed, then we will grab their numbers and place it into the database. All right, well, we will be doing blood pressure today, and what this will be testing is what pressure you have in your heart when it's contracting and relaxing. And so it's very important because it's a measure that you can't feel, and it's something that is very important to heart health and predicting if you're at risk for stroke or heart disease. And so we usually use an electronic machine, just that way we get a resting heart rate as well. We do also have manual machines if that's something that you would prefer. And so this is called the comfy cuff, and it will expand for people that have larger arms and give an accurate reading in doing so. So you will want to make sure that the cord is on the artery on the arm, and you want to make sure that their wrist is pointing up with their palm facing upwards, and that the cord, like I mentioned, is placed right on that artery. And you want to make sure that you have a pretty good grip on there, tightness, and go ahead and have the client relax, have their feet on the ground, take a few deep breaths, and make sure that they're not talking during this test. And then you'll just hit the start button. And it takes about 1 to 2 minutes to process, depending on how high up the machine has to go in order for you to get an accurate blood pressure reading. Now, once we have their reading, we will want to make sure to take the cuff off immediately following. Make sure that we are taking that off for the patient, not the client taking it off. And once you've done that, then you'll enter in their statistics into the database, and make sure to review the numbers with them. If you're in a small confined room, you want to make sure to point to the numbers as opposed to announcing them out loud, and explaining what the difference is between the systolic blood pressure reading and the diastolic. Then also listed at the bottom is the pulse or the resting heart rate. And as we know, optimal blood pressure reading is 120/80 or lower, and the resting heart rate is between 60 and 80 beats per minute. We will be doing body fat testing for individuals. This is using the bioelectric impedance machine, and this is a handheld device that sends a small current through the body that attracts more muscle mass, has more water in it, and so it allows the current to move through the body a little bit easier as opposed to fat mass. And this predominantly tests the upper body, and so you will get different readings if you're using, a bioelectric impedance scale or if you do caliper testing. It has a 2 to 3% standard deviation, and so we usually try to just get a baseline for individuals and let them know that it is not a 100% accurate reading, but it's a good trend over time to see improvement in their overall body fat. And so what you'll want to do is make sure that their hands are not wet, that they haven't had lotion put on them or used hand sanitizer just recently, because that could interfere with the current that's being processed through the body and give an inaccurate reading. On the machine, there are a few buttons. There's an on button, a down, up, set, and start button. So you want to start with the on button, and you'll want to program their information. Usually you can program them as a guest, and so you can just hit set. And then normal or athlete will pop up, and typically normal is what the setting you'll use for 95% of the individuals. An athlete setting is someone who exercises 6 to 10 hours a week, and so they're going to have a higher density of muscle mass, and so we'll want to make sure to change the setting for them. You'll hit the up or down arrow in order to change those settings, and then you'll hit set after each time. And then you'll want to program in their height right here. It goes up in 1/4 inches throughout, and so you can find their height. What's your height?
5'6".
Once you programmed in their height, then you'll want to hit set again, and then you'll program in their weight. And once you have their data programmed, it also takes into account their height, weight, age, gender, and into consideration as well as the impedance that's being sent through. You'll want to make sure to hold the machine straight out in front of you with your hands flush on the sensors, applying light pressure. There's no need to squeeze as hard as you can, but making sure that your hands are flush. So once you've given the client the body fat tester, hit start for them, and it takes about 7 seconds for us to get results. And once the numbers are displayed, then you will put them and display them to the individual.